Diabetes mellitus is a chronic medical condition that occurs when the body is unable to properly regulate blood sugar, glucose, levels. This condition is characterized by high levels of glucose in the blood, which can lead to various complications if left untreated. There are two main types of diabetes, type 1 and type 2, with the third form, gestational diabetes, occurring during pregnancy. Each type involves different mechanisms of glucose regulation and requires distinct approaches to management. Types of diabetes mellitus. Type 1 diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Insulin is a hormone that helps regulate blood sugar by enabling cells to absorb glucose. As a result, people with type 1 diabetes produce little to no insulin, leading to elevated blood glucose levels. This type is often diagnosed in children and young adults, although it can develop at any age. The exact cause of type 1 diabetes remains unclear, but it is believed to involve genetic and environmental factors, such as viral infections. Type 2 diabetes. Type 2 diabetes is the more common form of the disease, typically occurring in adults, although increasing numbers of children and adolescents are being diagnosed due to rising obesity rates. In type 2 diabetes, the body either becomes resistant to insulin or does not produce enough insulin to maintain normal glucose levels. This form of diabetes develops gradually and can often go undiagnosed for years. Factors contributing to the development of type 2 diabetes include genetics, obesity, poor diet, physical inactivity, and aging. Gestational diabetes. Gestational diabetes occurs during pregnancy when the body cannot produce enough insulin to meet the increased demands of pregnancy. It typically develops in the second or third trimester and usually resolves after delivery. However, women who experience gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Symptoms of diabetes mellitus. The symptoms of diabetes can vary depending on the type and the level of blood sugar. Common symptoms include frequent urination. High blood sugar leads to increased urine production. Excessive thirst. The body loses fluids through frequent urination, causing dehydration. Extreme hunger. The body may not be able to properly absorb glucose for energy, leading to hunger. Fatigue. Without enough insulin, the body's cells cannot absorb glucose efficiently, causing tiredness. Blurred vision. Elevated blood sugar levels can cause the lenses of the eyes to swell, leading to blurred vision. Slow healing of wounds or infections. High blood sugar can impair circulation and affect the body's ability to heal. In some cases, type 2 diabetes may develop without noticeable symptoms for years, making regular screening important, especially for those at risk. Risk factors. Several factors can increase the risk of developing diabetes mellitus. Genetics. A family history of diabetes can increase the likelihood of developing the condition. Age. The risk of type 2 diabetes increases with age, particularly after 45 years. Obesity. Excess body fat, especially abdominal fat, increases insulin resistance and the likelihood of developing type 2 diabetes. Physical inactivity. Lack of regular exercise contributes to weight gain and insulin resistance. Diet. A poor diet high in processed foods, sugar, and unhealthy fats can contribute to the development of type 2 diabetes. Ethnicity. People of African American, Hispanic, Native American, and Asian American descent are at higher risk. Complications of diabetes mellitus. If left uncontrolled, diabetes can lead to serious complications. Cardiovascular disease. High blood sugar can damage blood vessels and increase the risk of heart disease, stroke, and high blood pressure. Kidney damage. Nephropathy. Diabetes can damage the kidneys, potentially leading to kidney failure. Nerve damage. Neuropathy. Prolonged high blood sugar can damage nerves, causing numbness, tingling, and pain, especially in the legs and feet. Eye damage. Diabetes can cause diabetic retinopathy, leading to vision impairment and, in severe cases, blindness. Amputations, poor circulation and nerve damage can result in infections and, in extreme cases, the need for limb amputation. Diagnosis and treatment. Diabetes is diagnosed through blood tests that measure blood glucose levels. These tests include the fasting blood glucose test, the oral glucose tolerance test, and the A1C test, which measures average blood sugar over the past 2 to 3 months. Treatment of diabetes involves lifestyle modifications, medication, and, in some cases, insulin therapy. For type 1 diabetes, insulin injections or an insulin pump are necessary to regulate blood glucose. Type 2 diabetes can often be managed with oral medications, lifestyle changes such as diet and exercise, and, if needed, insulin. Monitoring blood sugar levels regularly is critical for effective management of the disease. Conclusion. Diabetes mellitus is a serious but manageable condition. Early detection and proper treatment are crucial for preventing complications and improving quality of life. Lifestyle changes, such as maintaining a healthy weight, eating a balanced diet, and staying physically active, are essential for managing diabetes effectively. With appropriate care, individuals with diabetes can live healthy, fulfilling lives.